Hi, I'm Dr. Adrian Avila. I'm a licensed marital and family therapist in San Diego and clinical director at Harmonic Development. Today, I introduce to you our esteemed guest, Dr. Knudsen-Martin. She's a practicing marital and family therapist and clinical supervisor at Portland, Oregon. Dr. Knudsen-Martin is a retired professor at several universities that include Montana State University, Valdosta State University, Loma Linda University, and Lewis and Clark College. Her lifelong scholarship focuses on how larger contexts influence health and well-being, and how therapists can address the inequalities that result. Dr. Knudsen-Martin is widely recognized for her work regarding gender, culture, marital equality, and relational health. She's also one of the founders of Socio-Emotional Relational Therapy. Dr. Knudsen-Martin has published over 100 articles, several book chapters, and authored or co-authored books that include Couples, Genders, and Power, Creating Change in Intimate Relationships, Socioculturally Attuned Family Therapy Towards Equitable Theory and Practice, and her new book to be released in December, A Step-by-Step Guide to Socio-Emotional Relational Therapy, a socially responsible approach to clinical practice. In addition of these, Dr. Carmen has been an esteemed consultant and a very important mentor of mine. Dr. Carmen, thank you for being here with us.
Thank you for inviting me. It's really a pleasure, and I enjoyed meeting your colleagues this morning and having such an interesting conversation.
Okay, thank you very much. Dr. Carmen, today I would like to discuss with you your working model, your SERT model, Socio-Emotional Relational Therapy, in working with veterans. Veterans are making a transition from military culture to civilian life culture, and that transition is not a simple one. I would like to hear some of your ideas of how your therapy model can help us help veterans.
Yes, thank you. Well, first of all, SERT, Socio-Emotional Relationship Therapy, was developed out of research where we actually studied our clinical practice, trying to understand how the factors from the larger society were playing out in what we were doing in the therapy room. And you, Adrian, were a part of that original research. So we've continued to evolve it and develop it since then, but you are also one of the founders of this model. Whether working with people transitioning from military culture to civilian culture, or whatever other issue people are bringing to therapy, SERT is unique from other models in that it always starts with sociocultural attunement. And what I mean by that is that the therapist tries to really get to imagine, to take in what it is like to be this person in the particular contexts they live in. So in the military context, I know that the military is organized very hierarchically. I also know from decades and decades of research from all kinds of sources that what relationships need is mutuality and reciprocal responsiveness to each other. So I begin by knowing that there's a difference between what people need in their close relationships and what is necessary if you're working and living in a military culture. I don't know what that means to particular people, so working from the SERT model, therapists begin by trying to understand that better, by getting to know more about that, and I'm sure we'll be talking more about that in a little bit. I also know that that there is this divide between the experience that people have in the military, which is very intense, where you need to follow the orders and direction that you're given, and what people in civilian culture experience, and that not for everybody, but oftentimes that experience is not only, military experience is not only not understood, it's also often minimized or disparaged, and certainly can create not only misunderstandings, but I think what's even more important from what we know about what people need is it creates distance between people. So the other point that's so important that I would bring right from the outset as practicing SERT is an awareness and wanting to understand what it means for the particular person or persons that I'm talking with, working with. We all need to be able to be open to taking in the experience of others and feeling loved and valued and supported by them, and that it needs to be an open flow that goes back and forth, and that is directly related to physical health, emotional health, relational health, well-being in general. So I know those things, and what I want to know is how is that working if you're my client in your life, and how has these different contexts, the military context, whatever other race, class, gender, community, family, experiences of trauma, how have all of those come in and sort of worked together to either support building human connection or to get in the way of that?
What are the core principles of socio-emotional relational therapy?
Well, there's really just a few. The first, as you might tell from the name, has to do with the societal context. So that's the messages that people receive about who they are, what matters, whether they matter, whose experience is important, and why. And those are shaped usually by the people with most power in society, but it affects everybody. So that's the socio part. And then there's the emotional part. And that is that as human beings, we are emotional. We're meant to be emotional. So our emotions are the connection between us as individuals and the larger society, and it's how we communicate quickly because we have to adapt to our environment. When things are going well, people are able to be open to each other. They can take in their own experience, somebody else's experience instantaneously at an emotional level before oftentimes it's even able to be a fully formed conscious thought or anything. But if people experience trauma, or if they've been socialized, as you are in the military, to kind of disconnect from that emotion, then people actually aren't even able to make good rational decisions. So that's the emotional piece. So I'm always interested in the connection between those two. When somebody is experiencing a feeling, an emotion, I know that that's related in some way to the relationships around them and the larger society around them. Which means that I'm also then interested in power. And that's a confusing concept for a lot of people, but what we mean in SERT by power is awareness that just by nature of being connected to one another in a shared world and in relationships, we affect each other. So power is about, it's not a personal thing, like it's not that I'm powerful, but it's a flow of power from one person or group to another. And that power determines whose interests are important, who gets attended to, who feels valued and attuned. And of course, in a well-functioning relationship that needs to go back and forth. And then the fourth thing is what I've kind of already mentioned, which has to do with relational needs, that everyone has them. Some people, because of their experiences in life, or what they've been taught, they feel like there's something wrong if they feel those needs or recognize those needs. And if you're in the military, I'd be curious to know kind of how that works. But when you're needing to be responding to orders, what your relational need might not be important at that moment. And so what happens and how do you do with that? So those are the 4 principles. Then what's really fascinating and for our work as therapists, and can be painful for people who are struggling with whatever issues brought them to therapy, is that there are so many different pieces. It gets very connected to vulnerability. It gets connected to our identities and how we know ourselves. So those are the main principles.
So you mentioned trauma, working with veterans. That's one of the primary things that we're working with. Mm-hmm. How does SERT, how does socio-emotional relational therapy deal with those kind of thoughts or ideas?
Yeah, when most people come to therapy, they don't usually come because they're happy about everything. And so they're struggling with something, or they're wanting to develop an aspect of themselves that they think could work better, their relationships. And it's easy so we either blame ourselves, or we blame our partners, and oftentimes we blame our parents, our mothers especially. And what SERT does is, yes, we learn to be accountable and responsible to each other, but we learn to see how we are also often falling into patterns and ideas that are in the society that we live in, and often they're competing, like being in the military is one set of values, and maybe being in therapy can feel like another set of values, and different cultures might interpret them all a little bit differently and such. And so with trauma, what has happened, whatever the cause, whether it's PTSD because of combat injury, whether it's witnessing violence to someone else, being the experiencing violence, or even the day-to-day, like being diminished by others that you're working with every day, or in the society through racism or other messages that say that you should be different than you are, we tend to blame ourselves. And trauma, what happens on a physiological and relational level with trauma is that the very same things that we need to be healthy, those relationally responsive connections with others, get shut down. And it's harder to trust, it's harder to even trust your own experience and what you're feeling. And what people need to get through that is others that can understand it and just sort of be with them in it. And people who have the more healthy relationships we have, be it our intimate partners, be it family or friends or a church community or whatever other groups we might be part of, they do better. And trauma skews a lot of things. And so the way that different people respond to trauma. Our group was talking earlier this morning about a case that you and I both worked on when we were starting to develop SERT, with a couple where the man had experienced PTSD from war experience, and his wife from interpartner violence, a different partner, not him. And both of them needed closeness and connection, but his way of dealing with it was by what he'd been taught in the military, what he'd been taught by the, a culture that said as a man he wasn't supposed to feel vulnerable or needy, and so he would distance from her, and then that would make her angry and not respond, not able to respond to him and what he needed. And when they came in at first, they were neither one was doing very well individually. She was psychically almost a wreck. He was almost a recluse. But by working with a compassionate, socio-emotionally attuned SERT therapist, it took them a while, but they were really able to develop some new patterns and deal with that trauma. And so how trauma plays out in people's lives has to take into account those. It's not like one size fits all. There's this stuff that happens in the body, but that really interacts with all those other factors in our world and what we've learned about what's called on us, the ideas about our identity and how what we think and do and feel.
You talked about identity, and what we see is that many folks enter the military at a very young age, when they're typically developing their own identity. So they enter the military culture and their identity takes a course. When they come out of the military, a different thing happens. They're part of a different world, and they have difficulty navigating how to become members of society, of having families, of having children.
Yeah.
How does SERT help to deal with that?
Well, SERT really works by thinking about or focusing on felt identity. So identity isn't just like, okay, I'm this white male, or I'm this husband, or whatever identities are important. It gets internalized inside us, so that it connects to the emotion that we feel. And when our identities are not validated, then we usually try to defend them. And so if someone spent most of their early adult years in a system that has very clear expectations about how you're supposed to relate, and then someone else, maybe your intimate partner, is not respecting that, or doesn't seem to be respecting that, or wants something different from you, then you not only feel incompetent or invalidated, but you don't know who you are, you don't know what to do. So one thing that SERT does is we have a set of what we call orienting principles for a relational identity, because we have, all of us have multiple identities. Like you can be in the military and have a relational identity, and you have to traverse going back and forth. And even if you're a veteran, you can't, you've had this experience. It's a part of who you are, but it's not the only identity. But I think a lot of times the way identity gets kind of talked about in our society It's like there is just this one way of being. And if you're, if I'm feeling attacked because of my identity, then I don't know what to do. And so the circle of care gives another framework. And there's 4 components of those, and we can talk more about those, but very briefly, they are things that may not fit with a military identity, like vulnerability. Each person being open to taking in the experience of someone else, even if it makes us feel uncomfortable. So it isn't only about expressing your own fears or doubts, but it is willingness to do that, to share what you're worried about or what you need relationally, and to own that you have those needs. And it's like a spirit of curiosity rather than like you don't have to know everything. So that's vulnerability, that's number 1. And it's a part of a relational identity which we call the circle of care. Second is what we call attunement, mutual attunement, when it's going back and forth. That means I not only expect you to understand me, but I'm focused on you. I'm noticing what you need, what you want. Now, in a military identity, those things are probably important in a lot of ways, but ultimately you're responding to somebody's direction, or you're giving the direction if you're at the top of the command. And so attunement is a much more egalitarian sort of back and forth about I get you, I want to understand you, I know we're 2 different people or 2 different groups, so we're not always on the same page. And that's then related to influence. Like if we are in relationship, we are influencing each other, necessarily. It's impossible not to. But if you've been taught that you shouldn't be influenced by someone, that you should be on top, and if you've been in a hierarchical context, you may, without realizing it, sort of operate that someone is always on top. If it's not, your commander, then it's someone else. Or if you're taking influence from your wife, maybe it feels like she's on top, and that doesn't feel good. So what is a relational identity? How might that be tied to masculinity, to whatever other identities someone might have? And then shared relational responsibility. What does it mean for me to think of myself as responsible for bringing who I am to that relationship, for noticing and caring about and feeling responsible toward the well-being of my partner or the others around me, and responsibility for the well-being of the group as all. And I think some aspects of being in the military very much promote that. And each person, it might work out a little bit differently. But I don't know that that's the answer you were expecting. But when I think about identity, I think I always come back to that identity is actually a relational thing. Like we only have our identities in relation to somebody else. I can't be a wife without a partner. I can't be a mother without a child. I can't be an employer without an employee. What it means for me to be a therapist is defined by professional standards, as well as what my clients think and my training. And it feels very individual, but from my perspective, from a SERT perspective, it's actually very relational. So your identities change whenever the relationships you're in change. And that's okay. I mean, like, we aren't all exactly the same person in each context. But some parts of our identity often don't get developed. So in SERT, we're really developing parts of our identity that might have been overlooked before, and that's not your fault. It's not the person's fault.
Relational identity, when veterans are used to having a hierarchical type of relationship, then they come out to their families, their spouses, or other relationships, and they want to have equal relationships, but it doesn't seem like they know how to.
Exactly. That's been my experience. Nearly everyone wants relationship, they want connection. A SERT therapist has developed the skills to help you name and identify those, because in our larger society, we don't very much. We talk about achievement, we talk about individual choice, we talk about a lot of things, but we don't necessarily help people recognize their relational ideals, and I absolutely agree. It's not that people, I always assume, and I think other SERT therapists assume the same thing, you know, that people want connection, they want relationship, and sometimes the symptoms or problems that bring people into therapy are a sign or a outgrowth of not knowing how, and that those things have then created oftentimes an imbalance in whose needs are getting addressed. And it's a problem between people, not a problem that belongs to just one person or the other.
Yeah, I see that in some veterans, they come out and as if they had enough of being under a hierarchy, and it gets into matters of power, and they don't like to be told what to do or how to be, and they struggle with their wives or their husbands telling them what to do.
Yeah, and you know that happens. It's not just military people who struggle with that, but resist being influenced by your wife. You don't, or you want to be the one to make the decisions and be in charge. Even people who identify, you know, like for religious or cultural reasons as head of the family, they want to play that role, but they want to do it in a more relational way, or some of the trauma or abuse or socialization they've had are making them do it in a more hurtful way. So it ends up hurting others, and then it keeps the client from having the connections they want, if in the example that you gave.
Power issues get in the way of fulfilling what one really wants.
Right. And you want a therapist who actually notices power issues, because yes, there's some relationships where dominance is really it's visible, and we all notice that. But a lot of the kind of things that we're calling power here, they're much more subtle, and they play out in ways like whose interests are shaping what we talk about. And if therapists don't notice it, they tend to, it's easy to reinforce those power differences, but you can't understand that unless you back up and look at the bigger picture and see, well, then what's affecting that relationship? What are the societal patterns that are getting in the way of people having the kind of relationships they want? Because I absolutely agree. At least people who are willing to come to therapy, it's very rare that someone says, no, I think I should be the one to make the decisions. She should just do what I say.
Is this where we get into the therapist is evaluating matters of fairness and equality in the relationship? So in your work with gender differences, men power, women's power, how does that play into your model, the gender part?
Well, it's complex. I mean, it can look very different. Certainly there are women who do have a lot of power in a lot of different ways. But one of the things that makes it a little bit hard for people in their experience is that one of the hallmarks of being in a powerful position, even if you don't want to be there, is you're not aware of others. So you may be in a powerful position, but you don't have the awareness that you're in a powerful position. People who, and by that your schedule, your needs, your interests are shaping what your partner's doing more than they're shaping you. And so if you're in a less powerful position, like if you are, going back to the military, if you're in the lower ranks, you know that, I mean, that's very overt. You know who has the power and who doesn't, and you're very aware of it, just like a student is aware of the teacher's power, right? But in intimate relationships, it is a lot more under the surface oftentimes, and but what can be very damaging to what people are trying to get in their relationships.
So, Dr. Carmen, in regards to power, there's a difference between being in a position of power and being a powerful man or a powerful woman, a powerful person. We find that sometimes veterans, when they go to their families, it's like they're not too aware of the level of influence, the level of power that they have in their families. And sometimes they go between recusing their contribution and their gains go with it. What are your thoughts in terms of being aware of one's power or one's influence?
Yeah, that's such an important question. And power, I appreciate that you brought it back to the difference between being an individual issue and being a relational. It's really, in SERT we call it the flow of power. Like in a more equitable relationship, the power is flowing back and forth, and no one person is in a position of power most of the time. But when an individual, or also a whole group of people, if we're in a position of power, the very nature of power, it gives us an entitlement. It's like what we want matters, other people, and we might say, no, that's true, not true. But the very nature of power makes it hard, unless you're very intentional. People, I mean, whether you're talking about parents tuning into their kids, or someone socialized that the role they're in means they're entitled to and expect to be what they want should just happen. When everything is going well and people are meeting our needs, we tend not to notice. And just as a sideline, in terms of whole groups of people, for example, I'm thinking about the experience of a couple people that I know who both grew up in the same small town in the South. One is from a black family, one's from a white family. The person who grew up in the black family knew who the white family was, they knew all about them. The white family, they didn't know the black family. And that's how power works. If you are in a position that's separate from the good person that you want to be inside, but if you're in a position where your needs and interests are just what's taken for granted as important, then you don't notice all the accommodation that other people might be doing. And the people who are accommodating might or might not be noticing either. Is sometimes people might be, especially if you've been socialized that as a man you're supposed to know what you're talking about, and people are supposed to respect you. But if you are in a one-down position in your workplace, in the military or some other workplace, or you're just viewed negatively in the larger society, sometimes then it's double hurt. You come home and you expect to at least be treated with that kind of, you might not call it power, but with that kind of respect at home. And so people end up not quite understanding what's going on. That's why the circle of care is so helpful. Then they can kind of break out of that. And I don't mean that they necessarily change everything, but they can begin to see inequities that when there was a power imbalance, they actually didn't notice. I don't know if that helps explain. Power is kind of complicated.
How difficult it is also to sometimes to bear all the responsibility, to be the ultimately responsible, the ultimate power in the relationship, how heavy that can be.
If you are, sometimes you're thinking you are doing that and you're not, but if you really are, even if you're only thinking it, it's also isolating. And so it's a heavy burden. I think maybe what you're getting at is this idea that I'm supposed to have the answers. If my partner asks me something or says, "What do you think about this?" It's not just here we are in it together, but it's like I'm supposed to know. And that is a heavy burden. And it is a burden then that, depending on how people react, can create distance, can sometimes create arguments, fights, but mostly just feeling misunderstood and alone. And so I think bottom line, you can't understand mutuality in the circle of care, which is then related to an equal flow of power, if you don't back up and understand that larger context again, and the vulnerability, like as you just pointed out, it is a very vulnerable position to be in, to think that you should be responsible, to have all the answers, and you shouldn't look incompetent, whatever other things people might. And that's a different kind of experience than the partner might be having, which is a vulnerability of, am I going to upset that person? Will I say the wrong thing? How can I protect my partner so they don't get distressed? Each person has a different kind of vulnerability. And those are related to the power positions that are put on us, whether we want them or not, just by virtue. You can't help it, because it's not even a good or bad thing, it's how society is. But when you're aware of it, then you have more choices about how you respond and how you choose to relate. And when you have to follow the who's up and who's down, like you do in the military, and when you try to make it a more equal flow of power back and forth, which is what promotes what we need inside to be healthy.
So another thing that we see in clinical work, that it's often the case that what veterans tell us is that there's this expectation outside in society that they are the strong, they are the powerful, that they have their lives disciplined and this way. And what we hear in the therapy room is that they don't feel like that. That actually they feel the complete opposite.
Mm-hmm.
And in many ways they experience things that they make them feel powerless.
Yes. Yes, exactly. I mean, that is just such a common experience, and why understanding that flow of power can be challenging if you don't have a therapist who has been trained in working with those issues, because if you, I mean, there's a whole, it could play out differently depending on who's involved and what their experience is with. I may even have been, had experiences of abuse in my own life, or at least I've been discounted. And I've learned to follow the rules and do what I'm told. And there's this social message that tends to be a masculine message. If women can get it when they're in positions of authority, I think it probably gets amplified in military positions, that you're supposed to know what you're doing, you're supposed to be in charge, you're never supposed to make mistakes, and others are depending on, literally their lives might be depending on that. And so to feel like now your partner, your wife or your children is saying, or your therapist is saying you've got power, it doesn't fit your experience. And yet what our clinical, as we've looked at our practice, what we see happen over and over and over again is it's those very messages that tell us we should be powerful, and they are not attainable. Nobody can ever know what they're doing all the time. And if they do, that's probably, if they think they do, that's really scary. All of us do better when we're open to the idea that somebody else's input might be important, that we want to learn, from the ground up as well as the top down and all that sort of stuff. And so, people who study masculinity in particular, say that this is just that is how it's not, just because you don't feel powerful doesn't mean you're not having an influence on others, which is another name for saying you have power. And so once you pay attention to that circle of care, and you have a kind of a new lens, a new way of looking at yourself and your experience, then you're not only are you able to see yourself differently and your family members differently, but they see you different. You start relating differently, and then they see you differently. But it is absolutely predictable that you may feel really powerless. And if you've been socialized that you're supposed to be in that powerful position, then anytime somebody else has an impact on you, especially your intimate partner, it feels like they have control over you that they shouldn't have. But you can't be in a relationship. I mean, it just is impossible if the other person isn't having an influence on you. Whether that's an emotional influence that makes you feel uncertain inside, or helpless inside, or needy inside, or whether it's an influence like, well, I'm doing this, but I don't really want to. And you might remember our colleague Douglas Hunegard, who used to talk a lot about the difference between doing something sort of, I'm checking things off a list. Okay, she wants me to do this, she wants me to do that, or I'm just doing this because the other person and it feels begrudging. It feels like I'm doing it because they're making me, which is really different than when you're actually attuned to your partner and you know what they need and you're doing it not only because you know what matters to them, but because it matters to you what their experience is. And it's hard to explain that until you've been in it, but trust me, it's worth it. It's worth it. I guess that's what I would want to say. It can feel, and we've been emphasizing more the male part in part because the military culture is kind of an exaggeration of patriarchal ideas, masculine ideas, that very few people actually want to live. I mean, they're ideas. They're not how people who love each other it's not what it means to be a good man or a good partner. It's not what people want, as you said earlier. But it can make you feel uncomfortable when you haven't been taught, when you don't know, and it's not your fault. It's not your fault that you don't know. But who taught you? Where's the model? Circle of Care is a model to start with.
I'm wondering about your recommendations for therapists, because with veterans sometimes it takes work or it takes time to help them speak, articulate very difficult experiences, especially to talk about their emotions, their feelings. And we as therapists, we want to help them, and we want to get to those things, but they're very difficult. In many cases, it can take a long time before a veteran can open up about those things.
Yeah.
What's your recommendation for a SERT if one is to become a SERT therapist? How can we help with that?
Well, the way I think about the work of the way a SERT therapist engages with the process is that we also then have to be relationally responsive. So that means that we know from our training and our experience with other clients, we know the kinds of things that are helpful in general, but we have to be responsive. We have to be attuned to our clients. And so if your therapist seems to be responding to you like you're just another checkbox, and maybe let's go right to a solution. That's tempting because we all would like to get better quick. But what you really want is a therapist who is wanting to get to know what your experience is, who can help you see the kind of social world that you have to navigate, the different, and being in my family one moment, being in my military setting another, and that you want a therapist. Therapists are people too. So we've learned these same stereotypes. We're subject to the same kind of ideas about how so we often respond to people differently depending on their gender, their race, their socioeconomic status, and such. And so you want your therapist to have spent time learning to actually go beyond the stereotypes, to take what we call both a not knowing stance, like I don't know what your experience is, but I do know enough, and a knowing stance. I know that what you're going through is not separate from the different roles that you play in your life and the different identities and social messages that have been put on you, and how that's playing out in whatever your clinical symptoms are. So hopefully your therapist, a SERT therapist, would have spent a fair bit of time learning how to do both sides of that. And SERT therapists are also, they focus on helping people find their resources, their relational resources, and they're directed toward the future. So we understand the past. We might express over time, as we get to know people, we don't push people to express emotion that they're not ready to express, but we're not afraid to be in it with you. And that can take courage not only on the client's part, but on the therapist's part. That we are, I mean, one of my firm beliefs is that we are not just victims of the past. In every new interaction, we all have multiple messages that we've received. We've talked about a lot of them today, the desire for connection and for relationship that gets stamped out, washed away by a larger culture that promotes disconnection. Some of the good things about the military connection is that people do develop connections with each other. So you want a therapist who can help you look at those experiences and then say, what do I want to bring forward? How do I want my experiences to impact what happens next, not only in my life, but if I have children, in my children's life, or even in our society's life? Who do I want to be? There's common myth that therapists are neutral. Like, this is a discussion for another day, but I'll just throw this out there, that what therapists do matters. The kinds of things we focus on, what we talk about, shapes the answers that our clients are going to give. If my client is not feeling safe to talk about their experiences of trauma or whatever it is, what is my part in that as a therapist? That it's not just a resistant client, or, you know, it's like it has to be something that we're in together. Some of the ideas about professionalism in our society are that, you know, professionals are supposed to be objective, they're supposed to be distant, they're supposed to always have the answers, they're supposed to know what they're doing. SERT takes a little bit different view of professionalism. So you would get a therapist who does know what they're, I mean, they are professional, they are trained, but they bring their heart, they bring their humanness, and their shared curiosity and their willingness to engage with you, but it is a little different way of being professional. And yes, they may invite you to experiment with some different strategies for dealing with certain things, but they don't expect that they know what's best for you until they know you.
Well, thank you very much, Dr. Carmen. This is very enlightening. Your wealth and depth of knowledge is very clear. I'm very impressed hearing you, and I want to thank you for joining us here.
Thank you. And part of the reason that I've been getting more clear is because I'm in the middle of writing a workbook for couples. It's called, at least right now, the working title is Closing the Gap Between the Relationship You Have and the Relationship You Want, a Socio-Emotional Relational Therapy workbook. So in a year or so from today, when we're filming this, that might be out, but it's something that therapists can use to augment their therapy, and people might find helpful as well.
Well, again, thank you very much.
You're
welcome.
welcome.
Thank you very much for joining us.
It was fun. Thank you.